Southwest District Health Board meeting took place this morning without incident, which is newsworthy unto itself. The first 45 minutes or so was open to public comment, most of which was filled with people speaking out against a mask mandate, which wasn't even on the agenda. But when they got into the agenda, the board talked about resources to fight COVID-19. They heard from medical experts about what the virus has done in the district from a health standpoint and the impact it's had on businesses. So far, so good on PPE. There's been a lack of compliance that has resulted in clustered cases of COVID, but the positivity rate has dropped a bit, and businesses have taken a hit, for sure. They also dipped into race a bit, talking about why minorities, specifically Hispanics, have been hit harder by the virus. Well, food processing plants have had high numbers of COVID, and guess who just so happens to work at such places? Well, Hispanics. And that's about the time, about an hour and 40 minutes in, that board member and Adams County Commissioner Viki Purdy decided to chime in with this nugget.
There's something else that you're missing when it comes to Hispanic, Black, and the Asian population. They are all very low naturally in vitamin D. And that's what we've been talking about the last couple of meetings is why aren't we telling people they need to check their vitamin D levels, start taking vitamin D, zinc, and is there something else we need to consider here as a board to push forward a protocol of hydroxychloroquine for those patients, that an early protocol when they get COVID, so that they don't have lung damage, they don't end up in the hospital? I mean, there's studies all over the world now. There's no denying that it works. So can we as a board make a motion to push this forward, have the state, do something about it and get it out there so that all the doctors can prescribe it as needed?
So here we have hydroxychloroquine, the same hydroxychloroquine President Trump has been pushing since March, anecdotally referring to how the malaria drug, which is normally used in the U.S. to treat rheumatoid arthritis and lupus, how much of an effective treatment it is for COVID-19. Except this is the same hydroxychloroquine the Food and Drug Administration just last month warned us against using, saying it can cause heart rhythm problems, kidney injuries, and even some reports of liver failure. And those studies that Commissioner Purdy could be pointing to, like maybe the Henry Ford Health System study, not very well respected. In fact, they're considered flawed. But we'll let Dr. Sam Summers, the board's physician representative, explain it as he did this morning.
There's a very large trial that was placebo-controlled where half the patients got hydroxychloroquine, zinc, vitamin D, and the other half didn't, and there was no difference. Outcomes were no difference.
And there have been several randomized trials that have come to that same conclusion. No difference. The National Institutes of Health, they even stopped the trial they were about to do in June because there is no proven benefit. But Commissioner Purdy, whose county of about 4,300 people, and at last count has had only about 18 confirmed coronavirus cases and no deaths, well, she was having none of it. Like we've heard a lot about the last couple of days, an elected official was not keen in accepting the testimony of a medical expert when it comes to the handling of a pandemic.
And I would beg to differ with Dr. Summers on those studies. There's a tsunami of evidence that hydroxychloroquine and zinc and erythromycin or another antibiotic work together, and they work very well, especially in the early protocol. Even there was a couple articles in the Lancet and another one in the American Medical Journal, I think it was, that had to be withdrawn because they were fraudulent. That early on treatment, it works, and it would work for our elderly people specifically to keep them from ever getting sick and having lung damage. So if you need some help finding that research, I'd be happy to help you with that.
We did ask for some help finding that research, and we just received an email from Commissioner Purdy just about 10 minutes ago. And we haven't had a chance to take a look at it yet, but we'll add it to this story coming up at ktvb.com. And by the way, no decisions or mandates made at today's meeting, and they will be meeting again in 2 weeks. And to be clear, hydroxychloroquine remains a prescription-only medication and is not available over the counter for anyone who wants it for COVID-19 or otherwise.